All throughout the month of December, we are spotlighting the women who are the epitome of the mission of the rose. During this episode, you're going to hear from Courtney Clark and how she was diagnosed during her pregnancy. Your contribution can help us continue to bring hope, support, and resources to those in need, to women just like Courtney. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Join us as we hear another story and we answer those tough questions that you may have.
My name is Courtney Jeanette Clark. I am a patient at The Rose, but besides that, I'm a mother, I'm a wife, I'm a daughter, I'm a friend, I'm a woman who loves God first, family second, and my dad always taught us God, family, work, and that's just who I am. That's who I am to my core.
And you're also a breast cancer survivor.
I am, yes ma'am.
And your breast cancer experience was very different than what most women have. So I'm just going to invite you to go ahead and share with us how you found what you had going on and what was going on in your life at the time.
So back in 2021, I was getting ready to go to a party with one of my friends, like a day party. And as I was getting dressed, I felt a lump in my breast. And I was like, that's a lump. I'm going to the hospital. And so I ran to the hospital that wasn't far from my house. And I actually had just had a baby at the beginning of the year, and I was still in touch with the midwives who took care of me. They didn't have any appointments, so they sent me down to the women's clinic, and I spoke with the doctor there. She examined me, and actually this part of my story is kind of heartbreaking for me to even say and talk about, but when she examined me, she actually laughed and asked me why did I think it was a lump in my breast, and I was like, because I feel a lump. And she said it was a clogged milk duct because at the time I was still breastfeeding my daughter. And I've had clogged milk ducts before, and I was like, this doesn't feel like that. I tried to work it out the way you're supposed to work out milk ducts before I, even went to her. And she said, does anyone in your family have breast cancer? And I was like, no. And she asked me, again, very condescending, why would you think that this is a lump? And again, I explained to her why. So she told me it was a clogged milk duct, and I felt kind of silly leaving because I was like, oh, I was overreacting. And then we skipped to 5 months later. My husband and I, we moved to Houston, and I found out I was pregnant. And while I was taking a shower, I felt the same lump. And I was like, this is not right. It's the same breast, the same area. So I called my midwife, and my midwife here in Houston was an African-American woman, and I explained to her what was going on, and she told me, let's go to the Rose. And I had no idea what the Rose was. I was like, all right, let's go to the Rose. What's the Rose? And she called, sent over a referral to give me an appointment. But as she was sending over the referral, you guys were really, really booked, and the next appointment wasn't for 2 months out. And I was like, I'm pregnant. At the time, I was 23 weeks pregnant. And I was like, this does not feel right. And this is not the first time I felt this. I spoke with Miss Sally Reyes. She was so amazing. She got me an appointment, on the phone. She stayed on the phone with me while I got my midwife to send over a referral, which was also chaotic because she was in the middle of a birth. So I was calling her. She was at a birth. And then I had to call the office where her sister was. I was like, please, can you just get it over? They ended up getting the referral over, and I actually got in, I think it was 2 days later. So I came to the Rose. My mom came with me, and I saw I can't remember his name.
The radiologist?
The radiologist, yes. And he was very nice. The nurses, everyone here was amazing to me. So I saw the radiologist. He did the biopsy. And the thing that I love about the Rose that I did not know until I was here is that you get results right away. Mm-hmm. I had no idea that was going to happen. And he came in and he told me that it was a tumor and that I would need to come back to have it biopsied. The moment I heard the word tumor, I got very emotional because in 2018, I lost my father to brain cancer. And cancer, just hearing the word to me, it automatically meant death because I lost my grandfather to prostate cancer. So when I heard the word cancer, I was like, I'm pregnant. I have a 1.5-year-old. I have a husband. Oh my God, I'm going to die. My baby's not going to make it, and my daughter's not going to know her mom. So it took me a minute to gather myself, and I called my husband, who was away working. He was in Colorado at the time. And I told him what was going on, and he immediately came home. His job hadn't even ended yet, but he came home, and we hit the ground running. So I think it was like 2 weeks later, I came back for the biopsy. They biopsied it, and it ended up being a cancerous tumor. From there, again, Miss Sally came in, and she helped me find an oncologist at Texas Oncology. And once I got there, we started a treatment plan. We came up with a plan. The thing about my cancer, though, like I said, is I was 23 weeks pregnant when I found out that I had breast cancer. So my midwife that I was seeing had to refer me to a specialist because she had dealt with a pregnant woman with cancer. And my pregnancy became high risk. I had to go every week to see a maternal fetal medicine doctor. And the maternal fetal medicine doctor, along with the oncologist, along with the breast surgeon, and along with my midwife, because she still stayed on, but just as like more of a support system. They all had to come together to think of a treatment plan. And the plan was, like, when I first found out, I was like, take them off, just give me a double mastectomy. And the breast surgeon was like, Miss Clark, you're pregnant, and we can't put you under that type of anesthesia and surgery at the time. So what we did, we came up with a plan, and I had to do 16 rounds of chemo, 4 of those 16 rounds while pregnant. I am very grateful to God. I'm going to say that a lot here. God is my source. I'm very grateful because I've met a lot of women during this process who's had to have the same type of chemo that I had. They call it AC, but they all call it the Red Devil. Mm-hmm. And they all had so many bad symptoms and so many bad things happen to them. And I had all 4 of these while I was pregnant. And the worst thing that happened to me is I lost my hair. I didn't get sick. I didn't get weak. My baby was fine. At the beginning, they were thinking that we would have to have him come out at like 30 weeks, and then it was like 32 weeks, and then I was scheduled to have him come out at 37 weeks, but he came out on his own at 36 weeks. And he is a healthy baby boy. He's 3 months now. Once I had him, we took a break from chemo just for like a month, just so I could spend time with my baby and see what was next. The next thing would either be breast surgery, which was going to be a mastectomy or a lumpectomy, or I would have to do 12 more rounds of chemo. I was praying for the surgery because I just wanted it to be over, but ended up being that I had to do 12 more rounds. So I'm actively right now still doing the chemo. I'm actually on round 5. I have 5 left. Starting Thursday will be 4 left. And it's been fine. Again, the only thing that's really happened to me as far as symptoms is I lost my eyebrows and my eyelashes this time. But this journey has been very difficult for me for a number of reasons. When I was diagnosed, I had to stop working. My husband had to stop working. And I've never really been in a position where I had to like ask people for help or ask for money or ask for pity, you know. And my mom, when we found out that I was diagnosed, she came up with this website. It's kind of like a food train. It's called Give in Kind. That's what it's called. And people could give financially. They could give gift cards, food, bring meals, help with childcare. And my mom set that website up for me, and she put it on her social media. And I was like, that's enough. I'm not going to put it on mine because I didn't want to ask. I just felt I come from like a pretty good family. My dad took very good care of us. We never had to ask anybody for anything. So I didn't want to ask. I was embarrassed. But I talked to my husband, I talked to my mom, and I was like, I'm just going to put it there. And the amount of help that we got from people and the amount of people who cared so much, it really overwhelmed me. My husband always says how good of a person I am, but that's my husband, right? My mom always says it, but that's my mom. And I know that I'm a good person, I'm a good friend, but hearing it and seeing it and like getting your flowers while you're here, it just really overtook me. And so that was a hurdle I had to overcome, though, like asking for the help that I needed.
Oh, yeah. A lot of people have trouble with that, especially, like you said, you've never had to do that before. You came from a fairly affluent family, and the whole idea of charity
Yes.
is just not something that you had any experience with. You wouldn't know how to do that. And there is that stigma. Oh, well, why are you having to ask for help? Yeah, all of those things.
Yes.
Now, this is some pretty strong chemotherapy, though. Even though you were lucky in that you didn't have as many symptoms, what went through your mind when you were having to take that while you were still pregnant?
Having to go through chemotherapy while pregnant was the scariest thing. I was worried about my kid. I was worried about my son. I actually did go through a few symptoms. So with my son, who's Antonio Jr., when I was pregnant with him, my fluid levels had gotten really low at one point, and they thought that we were going to have to do a C-section and have him. And I was just like, God, please no. And just sitting there in the chair while having my baby, I just kept thinking to myself, what is this? Because it's poison, right? It's poison that's helping you. But at the same time, what is this poison doing to my child? Am I doing the best thing for us? Should I have waited until after the pregnancy? But I found out that if I would have waited, the type of cancer that I have, it's invasive ductal carcinoma, and it's a hormonal cancer. So the hormones from the pregnancy was growing the tumor. So as I was growing my baby, I was growing the tumor. It was a lot to deal with. I was very emotional and just scared, really, really scared. Even getting the chemo, I wanted to have another biopsy while I was pregnant. I was like, is it shrinking? What's going on? Is it helping? Should I stop? Am I going to live? Are we going to make it through this? That was my biggest thing every single time was, okay, it's another day. Am I going to live? Okay, it's another treatment. Am I going to be okay? Am I going to get sick? Am I going to be able to walk back to the car? Am I going to make it up the stairs? Because we live on the 3rd floor, so it's already walking up the stairs while pregnant, and also after getting the chemotherapy that lasted for 4 hours. The Red Devil, when you sit to get it, it takes 4 hours. So it was scary. That's the
now let's go
the
to
best
your
word I have for it.
Right. Go to your situation. You stopped working.
I did, yeah.
Now, what happened with your insurance during that time?
Okay, so I have Medicaid now. When I was working, I didn't have insurance from my job because it just wasn't feasible. It didn't really make sense. But I have Medicaid, and it was pregnancy Medicaid. So it took care of everything that I needed while pregnant. And then I tried to apply for mothers taking care of kids Medicaid, because the pregnancy Medicaid ends in September. My treatment is going to last way past September. I'm going to actually have to continue treatment even after surgery and everything. I have to do a pill for 5 years. So I need insurance for at least the next 5 years. So I talked to Miss Sally.
and Courtney's talking about Sally Reyes, who is one of our patient navigators. And
Yes.
That was the first time I ever even heard your name, was when she was telling me all about this wonderful patient who was pregnant and had so many different things that were hitting you, and you still had a great personality or great attitude toward it. Yeah, you were just, I'm gonna beat this. But
Yes,
then when I'm talking to you at other times, I've heard just how really hard it was.
It was.
Just to get through it.
Yes. So when I talked to Miss Sally, she told me about there's a insurance for breast cancer patients, breast and cervical cancer. Mm-hmm. So at the end of September, I'm going to get help from the Rose. So many of your people here are so great for me, helping me, and they'll make sure that I have the insurance to cover.
And this is
treatment.
through, yes, a state program that the Rose has been a contractor for many, many years. And probably the only way that we're able to help women who don't have insurance get on into treatment. Now, of course, this is not going to be, like you said, this isn't going to be a short-term thing. You're prepared for.
I am prepared.
Quite a few more months at least.
Yeah.
Dealing with this. What is the next step?
So that's what I was going to say. Yeah. So actually today, I saw a plastic surgeon, and we're preparing actually to do my lumpectomy. And with the lumpectomy, I'll have to have a reduction and a lift. The lumpectomy is going to remove the tumor, which is great. Like I said, Thursday was supposed to be number 5 of my chemos, but it may be the last chemotherapy that I have to take for now. Because today when I saw the plastic surgeon, he said that him and the breast surgeon and my oncologist have all been in contact with each other. And I may be having the surgery before the end of September. So within the next 3 weeks, I'll be having the surgery to remove the tumor. That, for me, is exciting and scary. I'll explain that because, as I said, we just moved here from New Orleans. My mom lives in Houston, but she's in Dallas working right now. And I don't have a lot of help here. So having breast surgery means I'll have to be sitting, not lifting anything more than 10 pounds. My 2-year-old is 40 pounds and she loves to be picked up. And I also have a newborn. I also have a husband who's trying to reestablish income because we've been living off savings since February. So I need to have people helping me. My grandmother right now is actually at my house helping, but my grandmother is 79 and ready to go home. She'll be here, though, to help take care of the kids and everything, but it's just going to be a road ahead because I'll have to have the breast surgery, the breast lift, and then after that, I'll have to do radiation. Radiation is going to last for 2 weeks every single day. So every day I'll have to try to figure out what to do with my newborn and my toddler while I go to radiation. Also, I don't know what's going to happen with radiation. Am I going to get sick? Am I going to have the energy? I am a busybody by nature. So having cancer, quote unquote, slow me down has been very hard for me because I'm the helper. I help people. Like, it's just in my nature. I've always been that way. And so now I'm the one that needs the help, and it's hard to receive the help. It's hard to sit back and not do anything. It's hard to sit back and let my husband take over with the kids, let my grandmother take over with the cooking. That's hard for me. But I need to heal so that I can get better, so that I can have that victory story and that miracle of being a breast cancer survivor. When you asked me who I was, and I said everything but breast cancer survivor, it's because it's still hard for me to even say that or even look at myself and know that I have breast cancer. It seems unreal, honestly. Like, I look at myself and I'm like, I can't believe this is happening to me without feeling like pity for myself. But at the same time, it's so strange that it happened to me. Like, you don't ever think that it'll be you. You walk around and you see the stories, you hear the stories. And even like, I would go to the breast cancer walks and wear pink in October because it was cute. But now this year, it means something totally different. Like, I'm wearing pink in October and pink every day. And even today, I didn't dress up. I put on this is my chemo hair hat, and I put on my shirt about God because this is my life now. And I realized that. One of the other hurdles for me that I want to just talk about for a second that I never really talk about was the fact that I feel like as a Black woman, I didn't get the treatment I feel like I should have got the first time I said something, right? When I first mentioned the lump, even if the doctor thought that it wasn't, just do the work. Let me get an MRI or scan, some kind of scan just to appease me or make me feel better about what's going on because I'm coming to you telling you that I have a lump in my breast and you laughed at me. I normally don't really see race, and I know that that's naive of me because of the way I grew up and how I grew up and the type of friends that I had. I really try not to see race. But in that moment, now, like in the moment that I was diagnosed with breast cancer, the first thing I saw was race because I felt like if it was a young white woman that went in and said that, that wouldn't have happened. I feel like she would have gotten tests and more comfort than a laugh. And me as an African-American woman, I got a laugh. And I literally I'd never forget, I walked out of there feeling silly about myself. So silly that I don't even think I told my mom or anyone that I went to the doctor for that reason. My husband knew and my friend who I was on the phone with. I never told anyone else because I felt stupid. Like, I really felt stupid. I'm not even silly. I felt stupid leaving there. And I just think that, I don't know, like if it could have changed anything, but I feel like maybe it could have changed something. And maybe like if it would have changed, maybe I would have went through all the things that I needed to go through and I wouldn't have my baby, you know? So I think about it's a blessing in disguise, but also it's a big inconvenience and it's scary.
And Courtney, I hate that that's the experience you had. And I can't tell you how much, and I hate to go into research and statistics and that thing, but that is the number one thing we hear from women of color. They didn't listen to me. They blew me off. I didn't feel like I was heard. I didn't feel like I received the same care. I mean, this is a real thing. This is not something you imagine. It's a real thing. There is this bias that goes on. And I mean, I just really admire the way that you didn't immediately go to this is all about race. And, you had to really work through your own value systems with that.
I did.
But at the end of the day, it was. At the end of the day, it was.
Yeah.
And that's what's so sad. That is not just sad. It is, it's just unacceptable anymore.
And it's really scary, Miss Dorothy.
It is.
It is.
Yeah. And it's how, I'm just amazed at the fact that wasn't more aggressive. I mean, and you and I are talking very lay people stuff here because I'm a lay person, but just from what I know, that could have been really a whole different story for you, especially becoming pregnant, especially with that hormone receptors going on. You are a miracle walking. And I agree. This wasn't due to our modern medicine.
It was not.
No.
I always tell people, like, that's my thing lately. It's by the grace of God that I'm here. It really is. And another hurdle that I had to, get over that really broke my heart with this is that I breastfed my daughter up until February of this year. She turned 2 in April, and my goal was to keep going until she turned 2. And the moment I found out that I had a lump in my breast and I had breast cancer, that was stripped away from me immediately. And with my son now, we've actually we're on formula number 5 because he's having stomach issues. And I cry a lot about not being able to breastfeed him. And I'm just like, if I would have known about this, if I could have gotten help sooner, maybe I could have been past the chemo part. Maybe I could have breastfed him. Maybe not, but maybe so, and it's just, I feel like that was taken from me. It wasn't a choice that I had. It was taken from me. It was also taken from my daughter. We bonded in that. My husband would be like, it's time to stop. And I'm like, I'm going to stop when she turns 2. We had gotten to a point where it was just at night. I would breastfeed her, read her a story. And that was our time together. And I had to immediately just stop and tell her no. And she didn't understand why. She just had to she had to just stop. And that's hard. That was hard for me. It still is. So I struggle with it still now. I really do. Because that's just something that I enjoy doing with my kids.
So there's a difference in the way the children bonded with you?
Definitely.
Is that what you're saying?
Yes, 100%. I told this to, I can't believe I'm saying this here. I just told this to my brother and my sister-in-law. I love my son. He is my miracle baby. I honestly feel like he saved my life. But the way that we bond and the way that I immediately bond, it's different. It's a huge difference. You wouldn't know it unless you've been through it. It is a big difference. I love them the same, but the bond is just different. And maybe it's because he's 3 months and he can't talk yet, and I don't, we don't have conversations
no,
yet. But
you've got a mother's instinct.
Yeah,
you know
I
something.
Can feel
yeah.
the difference there.
And I think what you said is real important, that there really wasn't anything you could do. I mean, this was beyond any, what's the word I'm looking for? It's like you didn't cause anything. It wasn't anything you did. It's one of those horrible things that happens in life. Yeah. But I don't pick up a whole bunch of regret or bitterness or anything like that when you're talking.
I mean, I'm happy that I found out. I'm happy that I'm so beyond, like I said, grateful for the rose. I'm happy that I'm being treated. It's just, life has changed a lot for me. And so now I'm just trying to roll with it the best way I know how.
So fast forward to some of your treatment.
Okay.
Because I'm trying to remember what you were telling me about your port, and I think it's important for our listeners to know that not everything just works, even when you're having treatment, and that's when you want it to work the most.
So when I first found out that when they found out that the tumor was a tumor that was cancerous, we decided on chemotherapy. So I had to have a port placed. And I actually...
All right, explain what a port is. Now, I know most people know that, but just explain.
It is a little device that they put inside of you, normally in your chest, where the chemotherapy goes through. Instead of having to go through your veins and keep getting poked that way, they place a port. It's done surgically. It's an outpatient surgery, normally really quick. And you use it for however long you have to have chemotherapy. I went through another little hiccup with the doctor, the first doctor that put my port in. He came late to surgery. I was pregnant at the time. He came late, didn't really speak to us. Was like, "Hi, I'm Dr. Such and Such, and I'll see you in there." The nurses brought me back, and he came in. You know, whenever you have surgery, anyone who's had surgery, they do something called timeout, where they say your name, your allergies, and everything like that. But they have to get you on the table and ready first. He came in while they were putting me on the table and kept asking to do the timeout. And the nurses were like, "We're not ready." And he's like, "I'm in a rush." And I can hear all this because I'm not sleeping yet. So they did the timeout really quick. And the nurse was really upset. As she was talking about being upset, I was falling asleep because I didn't hear everything she said. But during the time, again, I was pregnant going under anesthesia. My husband was waiting in the waiting room to get word that everything went fine or I was okay. The doctor never went out and talked to him.
Oh my gosh.
I was in recovery. My husband did not know I was in recovery. I had to ask someone where he was because he wasn't there yet. And that nurse found out that the doctor had never given my husband an update. So that was one thing, and it was terrible. 2 days later, we went to have my first treatment, and the nurses couldn't get the port. So with the port, with the type of chemo that I had, they had to have something called blood return, where they check to see if the blood is coming out to make sure that the port's working. I got no blood return. They tried about 5 times. At that point, I cried because I was like, it's important for me to get this chemo, and I can't get it because the port isn't working. So that same day, I was sent to the hospital to have the port removed and have something called a PICC line put in. A PICC line is basically a really long IV needle that goes into a big vein. And it's kind of like a port, but it's not a port. It's a PICC line. So I had to go have that placed. And then I went through all 4 of those treatments with the PICC line. Got the PICC line taken out after having the baby, and we were going to do a port again because the port is much easier. So I had a port placed earlier this month in August of 2023, and I had 4 of my treatments done and through that port. But I kept telling my husband something felt weird, something in the area of my chest and my heart felt heavy. It just felt weird. And I was at home and I had a fever of 102.9 and my blood pressure was 191 over 103. And so I called my oncologist and he said, "You need to get to the hospital." I went to the hospital. They got my pressure down. They gave me something for a headache and they sent me home. But they ran some blood tests to see if I was septic or not. But they said if I was, they would call, but they didn't think I was. The very next day I go home. I'm really, really tired. I couldn't even take my daughter to school. Couldn't really play with my son. And my fever was up again. It was 102.6 this time. And I called the hospital and they told me just to take some Tylenol and rest. Took some Tylenol, I laid down, and 30 minutes later I got a call from the emergency room telling me that I was septic. So I had to go to the hospital. I was in the hospital for 6 days. And even during that time, the way I was treated was terrible. I had 2 IVs placed in my arm, when I first got to the hospital, because they said they would have to clean my blood and give me all kind of medications. And I do have a medical background. I have an LPN license. So I know a little bit about blood draws and, what's going on. I never ever say that when I go to the hospital though. I just sit and I let people do their job. I never ever talk about my job. But when the phlebotomist put the IVs in my arm, the blood stopped coming. And I was like, that's not good. But she told me, "Oh, it's okay. Once you get upstairs, they'll be able to take your blood, no problem." So I go upstairs, they start taking my blood. And then by the second day, 2 of the 2 IVs that she placed had blown, which is when your IV blows, that means they can't get blood.
Right.
So they tried to stick another IV in my forearm. 3 people stuck me, couldn't get it. Then they went to my other arm, my right arm, forearm, and they had to call someone from like ICU, and he came and he got it. But it wasn't a good vein. And I said that before he left. I was like, I think this one's going to blow too. And he was like, no, I got it. It's fine. Later on that day, I was getting medication in my arm. I was getting the antibiotic. And my arm felt really, really cold, and it got swollen. And I called the nurse, and I was like, something is wrong. And she's like, okay, well, let me go check and see. And I took my IV out myself, and I told her, nobody else can stick me. I need to talk to like the charge nurse because this is ridiculous. So they ended up putting what's called a midline in my arm. And they did a midline is kind of like a pig line, but shorter. They gave me medication through that. The very next day, they did it because at this point I still had the port in and I was still septic. The next day, I had surgery to have the port taken out, and I had another PICC line put in so that I can have that done for chemo. When the radiologist who was going to put the PICC line came, he got quiet when he was taking the midline out. And he was like, that's strange. And my mom was like, what? What's going on? Because my mom at this point was like, Mama Bear. Someone at the hospital put the midline in an artery instead of a vein.
Oh my gosh.
Yes, I have been through a lot when it comes to hospitals and treatment and everything. So that was a whole other thing. And the hospital that I was at, they apologized, but it was unacceptable because, again, I'm going to say it. I feel like if it was a white woman there complaining and explaining what she was feeling, they would hear it. I don't feel like I was heard, and I really 1,000% feel like it was because of my race. I don't feel like it was anything else because I'm very polite. Not being rude. If you're a nurse, you can see. I saw it, and I haven't practiced in years. It's been like 5 years since I practiced, and I saw it on my body. You can see when someone's arm is swollen. My mom saw it. My mom has no medical history. I was just being ignored once again. And so I went through that, and I guess I didn't even think to talk about it because I tried to see the positives all the time in things. My husband says that I see rainbows and butterflies and everything. And I tried to be that way. But when it comes to my health and what's been going on with me, it's been a lot. It's been a road. It's been hard. And sometimes at night when everybody else is sleeping and I'm up thinking, I pray and thank God, but I also cry a lot because I never saw this for me. This is not the life that I saw for myself. This is not the life that I planned for myself. I didn't plan to be treated the way I've been treated in those situations.
But Courtney, you're such a good advocate for this. And I'm just not placating or anything. Most people don't talk about it. Mm-hmm. And you're willing to talk, and you're willing to say, I wasn't heard. And, everyone needs to understand when you're in that position, you're already vulnerable. You're already not feeling like you can speak up. But when you knew that something was going on with your body, I think the bravest thing you did was say, nobody else is going to stick me. Yeah. Yeah. So, I really hope our listeners hear this. And it's not just what you're talking about, but it's all of the stuff. It's everything that went together to give you a very different kind of experience, and one that could really make you question if people are really able to do what they're telling you they're doing. And, of course, that's the worst thing. We always say around the Rose that, the most important part about your recovery, besides all of your faith and your everything that you have to put into it to recover, including not doing the things that you always could do before, but is also having that confidence in who's treating you. That is so important. Yes. And we're a big believer. If that doesn't work, you go find somebody else. Yes. It is your right. It's your body. Nobody's going to stand up and say, take me when it comes time. Yes. So it is your body. I think that's of all the messages I hear from you, I think that's the one I hope our listeners take to heart because it's an important one.
And something you said just now that I really want to piggyback off is you said that I spoke up and I was willing to share. I want you to know that I am not that kind of person at all. I'm normally oh, it's okay. I won't say anything. I don't speak up normally. Going through this journey has taught me to really stand up for myself and speak up for myself. And even coming here today doing the podcast, I was like, oh God, do I want to do that? I'm scared to do it because I want to highlight what's going on. And I even, my husband has been like just recording some things, and I've been going back and forth about like, once it's all said and done, I want to share my story, but also in the world that we live in of social media and like people just wanting attention, I never want to seem like I just want attention, but I want the attention to be known for what's going on, because I feel like at 30, I'm 37 now, but you don't have to quote unquote get checked for a mammogram until you're like 40.
40, I know.
And I'm 37 and I've been having this tumor since at least 36 or 35. Who knows how long it's been. And that to me, I feel like it's something that I wish could change. I wish that you didn't have to have like a family member that has cancer or that has breast cancer to get tested early. Like I wish that it, like when you get like when you go to the gynecologist, I wish that they're like, okay, well, when you turn 21, 22, you should start getting mammograms or start getting screening, just something. Because I think about my daughter, I think about my son, like men get breast cancer too.
Right.
And no one in my family has breast cancer, to answer the question that that doctor asked me very condescendingly, but my grandfather had prostate cancer. When I found out about my breast cancer, I found out that prostate, breast, ovarian, and I forgot the other one are all related. So although no one has breast cancer, my grandfather, my maternal grandfather, died from prostate cancer.
Yeah.
Immediately, like you should have just asked me about cancer, period, not breast cancer. And then maybe you would have run the test, and then maybe we would have found this early. And then maybe I wouldn't have been so stressed out while pregnant going through chemotherapy, you know?
And all of those things are so true, but mainly that you know now that you do have to be your own advocate.
Yes.
And that is the biggest message you could send to anyone. And, you know, the whole thing about telling your story, and I know it takes a lot. I know that. There was a time we couldn't tell our stories. There was a time when women had no idea what was going to go on. And so many times, if you just know one other person's been there, you know, I mean, how many people have I heard that had port problems, but you wouldn't know that can be a very definite problem unless someone says, well, let me tell you this part of my story.
Yeah.
And it's not, you're not looking for sympathy. You're just wanting folks to know this could happen.
Yeah, that's exactly right.
Well, I tell you what, I think you're one of the bravest people I know. And, you know, I'm so glad, Antonio.
Yes.
He is in good health.
He is.
No problems, right? Dead from the chemo. And you may be ending your chemotherapy treatment?
Yes. I actually ordered, I did this very prematurely. I ordered a shirt from Amazon and it says, hip hip hooray, my last day of chemo today. Ring the bell and run like hell. So I think I'm going to wear that on Thursday, hopefully, and be able to ring that bell.
Hey.
And that is such a, I don't mean to cut you off, but I want to say that ringing that bell is going to be such a like moment for me, because when my dad finished his chemotherapy, I was with him when he rang the bell, and he was so excited, and it was such a good thing to do. And I get to ring the bell and beat this. My dad rang the bell and he didn't beat it, but I'm going to beat it. And I'm going to ring that bell and run like hell and go through my surgery and heal from that, and then go through the radiation and heal from that, and pray to God that it doesn't return. And just, I really, really, after going through this, I've decided that I want to find some way, somehow, to be an advocate for women, especially young African-American women, because we don't think that it'll happen to us. We really do not. Like, more than you could ever know. It's something that is like in the back of your mind. You don't think it. You couldn't have given me $1 million in front of my face last year this time and said, hey, next year you're going to be going through chemotherapy. Take this $1 million, because I'm telling you. I'd be like, keep that, because no, I won't. And look at me going through it. I had a wedding last year. My husband and I finally got to like have our big wedding. We got married in 2019, and our wedding was supposed to be 2020, but then, 2020 happened. Yeah. And last year we had a blast. We had our wedding. We went to Jamaica. We were in Jamaica this time last year. Like, you couldn't have told me I would be going through chemotherapy and fighting breast cancer, but I'm a fighter, and I'm going to keep fighting, and I'm going to win. And like I said, I just want to be as much of an advocate for other women as I can be. Not just African-American women, but mainly African-American women who don't know how to step up and say, hey, I felt this and I need help, and I need someone to listen to me. Like, really, really, like, listen to me. Don't tell me what you think. You went to school for a reason. You're a doctor. So run the test. You have the insurance. Run the insurance, get paid, run the test. The worst that could happen is that I'm wrong and you're right. That's the best, right? I said the worst, but that's the best thing. That's the best outcome. The worst outcome could be that I did find something and now I need the help.
Right.
And that's where I am with it. And I pray to God that I can find the strength and the courage to be that person and find ways to talk to people and share my story without getting too emotional or too scared or too crabby.
It doesn't matter if you're emotional, but I will tell you, we so appreciate you sharing this with us today. And we are certainly joining you in your prayers and wishing that we hear from you on Thursday that, hey, I did ring that bell.
Yes, ma'am.
Thank you so much for being with us.
Thank you for having me. I really appreciate it.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.